So right before the start, I would just like to recognize the important contribution of our community members and community workers, because they've been in this whole response with us. Without the community, we would not be going anywhere, and that's why we are having this conversation right now, right? So right before we start, I would just like to hear everyone to say this important quote with me, with us. Can you say it out loud, please? Yes? 1, 2, and 3.
Don't walk away.
Oh, no. Sorry. That's the lyrics of a song. Sorry. This one. All right. Can I say it out loud?
Nothing about us without us.
Yeah. Nothing without us. Nothing about us without us is a campaign that emphasizes the importance of involving people affected with and also living with HIV, right? And the key populations, involving them in programs development and also policy making. Key populations possess first-hand experience and valuable insights on living with or being affected with HIV. Oh, not this. Okay, now, first and foremost, we would like to define what community is. Community is a group sharing a common identity. It is defined by a variety of factors, including geography, ethnicity, religion, or shared interests and experience. Do we need to have what they have for us to be able to understand what they're going through? I believe not. All of us are given the skill of being empathic to understand what they're going through. And that's why, as a researcher, it's important for us to understand what our community is, so that we'll be able to relate with them and also to understand what they're going through. So that's why community-based research is also defined as going beyond the traditional researcher participant model and engages the community members as equal partners throughout the research process. And the whole goal for today's session would be emphasizing that we are, as key populations, all of us are more than a research participant. We could be a researcher. We could be a part of the decision-making process. And why is it important to include them in our approach, in our research studies? We believe that including the community-based partners will improve the outcomes of our research by achieving the relevance and responsiveness. By definition, by involving them, the community members, by involving us, community members, research becomes more relevant to their specific needs. Community engagement ensures that interventions address challenges and barriers faced by those affected by HIV. It's also important to include the community in order to increase participation. Community involvement enhances the participation of marginalized groups, such as people living with or affected by HIV, by giving them voice in the whole research process. And lastly, it will also emphasize trust and collaboration. Building trust between communities and healthcare providers and also researchers is vital. Community-based approaches foster trust by involving community members in the research design. Right? We have already had a lot of examples of community-based approaches. We know the important contribution of the community in our fight during the COVID-19 pandemic, reaching out those who had difficulties accessing HIV services during the pandemic. Community was there at the front line, linking the clients to healthcare providers. And we also have the community-based testing, which has been very, very successful. In the Philippines, CBS, or community-based screening, has been the #1 contributor of the increased testing services and capacity in our country. And lastly, advocacy and policy engagement, as I've mentioned a while ago, it's important to include the voices of the community in order to really understand what they need in order to make it more people-centered and community-based, right? Anyway, I will not be going through all of this because our speakers will be digging deeper into these principles and concepts later on. But I guess everyone already understands the importance of why community-based approaches is necessary in our endeavor, in our response in HIV care, right? And most importantly, community-based approaches in research will be anchored in the principles of equity, social justice, and respect for human rights. And that's why we always put people first. People first means improving empathic language. And we don't say infected anymore. We don't say HIV infected anymore. We always put people first by our language. And one of our speakers will also delve in deeper into that language later on. So to introduce the speakers for today, we have the first session, the second session, and also the third session. The first session is going to be the application of community-based research framework and models. This will be delivered to us by Rainier. Rainier has been doing a lot of great job in Singapore. Dr. Rainier research broadly revolves about social determinants of health and social epidemiology. He has a special interest in the use of both quantitative and qualitative approaches to address the social and behavioral dimensions of HIV, sexually transmitted infections, and substance use. Our second speaker will help us understand more how to translate ethically, professionally, and sensitively HIV evidence into community language. We have Dr. Ben Bavington. His research focuses on studying the behavioral and epidemiological aspects of HIV prevention among gay, bisexual, and other men who have sex with men, as well as transgender women in Australia and the Asia-Pacific region. With almost 20 years of experience in HIV prevention, he has been involved in community education, policy development, capacity building, and research nationally and internationally. And our last speaker, but definitely not the least, we have Inad Rendon. Inad is, he was born and raised in the Philippines, but he is now based in Thailand. He identifies himself as a gay man and openly living with HIV. He works with APACC as programs officer, and he has been with APACC since 2013. And I can't emphasize the excitement that I'm experiencing right now, and especially that I will be co-moderating with my mentor and professor, Professor Monica Ko. She is currently the Vice Dean of the Medical College in National Cheng Kung University. Dr. Ko is recognized as a Fellow of American Academy of Nursing and Senior Fellow of Higher Education Academy. She is well-known advocate for social justice and health equity and human rights advocacy for minority population in Asia. I think all of us are ready right now, but Dr. Ko will be there later on for the question and answer, and it will be an exciting part. All right, I'm gonna call on now our first presenter, guest speaker, Dr. Rainier Tan, to give his discussion.